Um, Good afternoon. On today's video, I will want for us to learn about the key differences when it comes to constitutional symptoms and that of classical symptoms. Most of the time we are seeing symptoms like loss of appetite, nausea and vomiting, headache, weakness, malaise in many disease conditions. In many disease conditions, you see some of these symptoms repeating themselves. So more of which we are looking at constitutional symptoms. In constitutional symptoms here, we look at how the body generally responds to illnesses. It tells us how chronically or acutely this person is when it comes to the disease condition. So that's why we normally do have these constitutional symptoms as per fever, headache, muscle pain, loss of appetite, nausea and vomiting. They do normally tell us about the body respond and more of which you see them in chronic illnesses. Whereas on the other hand, on classical symptoms, this tells us about disease specific. It tells us about the particular pathology that we are dealing with. For example, if you take a look at these symptoms like epigastric pain, the burning sensation, more of which you are thinking about peptic ulcer, abi? And also if you think about chronic productive cough plus pleuritic pain, I know you might be thinking about pneumonia and a patient experiencing polydyspia, polyphagia, and that of polyuria, and no more of which you are thinking about what? Diabetes mellitus. So more of which in classical symptoms, it tells us about the disease specific. It tells us about the organ being affected. So if you see classical symptoms, they are pointing to the disease specific. Whereas in constitutional symptoms now, we more of which are dealing with how the body generally respond to these illnesses, being it acute or that of chronic. So to this, that's for it. I am Andrew Mosiri Jr. Thank you.